Okay, so today we are going to discuss about the cancer and the importance of early diagnosis. So first, as a layman, uh, the people often misunderstood uh, uh, that due to lack of the understanding of the medicine. So they think that the hospitals are unnecessarily charging them, and they are doing a lot of they are making money, so they are using unnecessary diagnosis. So first of all, I would like to clear some important points in terms of the personal health, and in terms of today's most prevalent disease, that it's cancer, and the importance of early diagnosis in the cancer. And it can be any type of cancer. So you all must have a basic awareness about the cancer and about the significance of early diagnosis. Okay, so first of all, we all need to know about the word cancer. What is the word cancer? What are the obvious uh, clinical symptoms that need to not be overlooked, and they must need to be uh, taken into serious consideration? So if you are having a constant something, any feeling out, and that should be, if it is out of nowhere, you are feeling constant pain in some of your area, if you are feeling constant swelling, constant urination, constant diarrhea, so abnormal diarrhea or something. So these are certain things that a person or a patient must need to know things about their self and their body. So before the doctor can see the symptoms, or doctor can see what are you are going through, the patient, a person must be able to self diagnose or examine. Okay, so let's have a very simple example, that if a female if she's taking the shower and she's experiencing lump in her breast, so she should not ignore that. Okay, if someone is having a very very extreme pain in their bones, okay, and they are having a lot of pain in their bones, so they do not take it for granted. If a male is experiencing problem in the urination, so and they are having very the urge to urinate, but passing a very low urine, so they must not take it for granted. Okay, your body is always indicating you certain things that you have to keep in your mind. You have to notice that you have to go to a, a physician for your examination. Okay. Okay, so as per cancer statistics, so as you can see that there is the age standardized rate of the number of the cancers, um, patients, incidence rate. So according to the countries, so UK, Scotland is on the top, whether they are males or females. Then if you see the The very low incident countries are the Kuwait, Uganda, Chile, uh, Ukraine. In Turkey, there are male ratio is very high in terms of cancers. Um, in every area, female statistics is a bit low comparatively to the males, and this is the in China, the male prevalence is more than females, and so on. So you must be familiar with the statistics of the cancer in your country and in your city. Why it is very important to be familiarized with the statistics. Unfortunately, that normally people are now not have the habit of reading the newspapers, and in newspapers there are some health uh, sections which normally address these issues. So if you are not the habitual reader of newspapers, so obviously you may not be aware of the cancer statistics and cancer prevalence and incidence. So now the second thing is that after making yourself aware with the statistics of general whether males or females are encountering or what, you must be familiar with the type of cancer in your area or in your um, country. For example, let's have a look. If I will, there are okay. If you don't have the habit of reading the newspapers, so what you can simply do is just take out your Google and just search the cancer statistics. So, so cancer statistics worldwide. Okay, so now AI is everywhere, and AI is just updating you with the fact that you can just quickly get a response instead of going to specific websites or authentic platforms. AI is summarizing the stuff for you. So it's not very difficult to go and search. It can simplify the words for you. So if you are a non-medical person, so it is also a very easy thing for you to understand that. So like in if as I am a cancer biologist, so I know that the information it is giving is more or less correct. Okay, it's not wrong. But obviously I will not recommend to rely on the AI informations, because it is just a program and which is just fetching the information and all that. So you must have to be a bit background knowledge to determine that whether this knowledge is correct or not. So, in 2022, nearly 20 million new cancer cases and 9.7 million cancer-related deaths were reported globally. Okay, by 2050, these figures are projected to increase to 33 million new cases. Okay, so now there is a website that is known as Global Cancer Registry or statistics, what you can say. And there are various research articles and papers who are demonstrating uh, uh, different things. Like if we look at this picture, so here the map is basically defining the percentage populations that are suffering from the cancer. Okay, with different color codings. And here, if we see, so human development index, and so if we go to different, okay, so if we have a look on the types of cancers and like which cancer is the most prevalent in male and female. So you must identify your risk factors, your habits, and all of those stuff. So obviously you are not a person for a medical person, so you may not go through or understand these things. But what I'm going to show you is that if you see the lung cancer rank one in terms of incidence. Okay, so incidence and mortality, like the deaths from the lung cancer are top, and the incidence is also on top. Then female breast cancer ranked second, then colorectal cancer, and then prostate cancer. So these four are basically on the top. Then liver, then thyroid, then different parts of the body. So there are different sites and all that. So how and when you should be serious about your health, your body, your habits, and all that. You should know simple basic things. Okay, so first, the first thing I told you is to adopt a habit of self examination. Okay, so self examination is extremely very important for each and every person about their health, because neither your mom nor your dad is going, you are grown up and nobody is going to check you every time that you are doing this, you are doing this. So there are some personal body parts which not everyone is allowed to see or touch. So you have to be aware and do your self examination. Then second thing is to, you must have a habit of reading the health section of the newspaper. Okay, so have a habit to update yourself with cancer stats. Okay, so okay, so obviously not everyone can do this by themselves, so it's the responsibilities of scientific peoples and doctors to bring out the awareness among the local people, local laymen. Okay, so there are so many things which really need to be taken into consideration when health professionals are guiding and counseling the families. So so the today discussion is mainly focusing on before going to doctor. Okay, like me, like you, we are in normal state of our body, and in order to be to take precaution, what we should do. Okay, so this is our whole discussion topic. um okay, let's suppose we have there is a woman. She is having a lump on her breast. Okay, and she goes to the local doctor, local in terms of that, because in generally in mbbs, um normal physicians, mbbs, simple mbbs doctors, they are taught a very little portion of the cancer, very little part. And there are various different, and it depends that which doctor has practiced or done house job in which kind of field. Then if someone is opening their clinic or private thing, so uh, they don't have that much awareness regarding that particular disease, and that particular disease requires specialization and even the experience. So local doctor Here I mean local doctor means simple MBBS doctor. Okay, but for this kind of thing, like if a woman is experiencing lump, so she should not go to simple MBBS doctor. Okay, if she is experiencing such thing, so it would be better that she must consult an oncologist. Okay, or gynecology, gynecologist. But it's better to go to the oncologist. But for that, you must have, before that, you must have the self examination habit. Okay, and you must have the updated yourself with the cancer statistics. And if a lady is aware, if she is not aware, so she will go to the local MBBS doctor. But if she is aware with the cancer statistics, which says that breast cancer is the topmost cancer, top cancer in females. So if she is well aware by this statistics, she will not prefer to go to the any clinician. She would prefer to go to the oncologist. Okay, so she would prefer to go to the oncologist. So then the oncologist will examine you, and if they see like out of their experience, out of their studies, if they feel, they will request some test or examination, simple external examination. Okay, so these are some important things that then no matter if what the results come, maybe this lump is not hazardous, it can be treated with the medication or something, but that decision should have to be taken by the oncologist, not by the person itself. Okay, that I should go to the simple doctor or I should go to the oncologist. So this is the very first thing a person really need to do to avoid the last stage uh, in diagnosis of the cancer. So to avoid all those things, so one must first have to go to the oncologist at very first, at early, because you are responsible for your own health, and no doctor are not coming to self examine you on your daily basis at your home, and no one is going to update you. So it's your responsibility, it's your life, your health. You have to update yourself. You have to self examine yourself uh, with different things. So if you are a female, you should be self examining your breast and other things as well. We will come to different scenarios later. But self examination and habit awareness about the cancer is one of the most important thing.